Hello everybody, my name is Travis, this is Dr. Steven. We are from Crux Chiropractic. We have a really cool and important activity for you today. It's a hip hinge. We're going to show you a couple different variations of this, and you notice here I've got my broom and we're not cleaning the place up right now. However, a broomstick or a dowel essentially represents your neutral spine. And it's so important if you are dealing with low back pain or any movements to maintain a neutral spine, and this is how we're going to show you during our variations here. So what Dr. Steven is going to do is he's going to take the dowel, he's going to bring it behind them, and take a notice. Top hand is going to be at the crook or the small of the neck. Other hand is essentially going to be at the small of the back. And we're looking for 3 contact points here. We're looking for a contact point at the head, a contact point somewhere in the middle of the back, and then a contact point essentially right above the butt or the sacrum, okay? He now has neutral spine, and I'll have Dr. Steven kind of show you what it looks like to not be in your spine. So go ahead and kind of bend for me. Notice that we've lost contact here. Notice that his hips have shifted. Notice what it looks like when we maintain all these spaces, okay? Here's a little arching through the back. So the only spaces that you should look or feel is a little space in the neck and a little bit of space in the lower back. That's it. And we're going to maintain those 3 contact points during the entire activity. So now, this is the basic hip hinge, all right? I'm going to have essentially what Dr. Steven's going to do while maintaining all 3 of those contact points. He is going to bend at the hips. He's going to drive his hips behind him. He's going to allow his knees to bend passively. And to stand, he will push his feet through the floor. I do not want you to worry about your lower back. This is not a low back exercise. In fact, this is an activity for the hips and the feet and coordinating through the upper back. So again, look at this great job that he's maintaining all 3 points. Now, I'm going to have Dr. Steven do it incorrectly. Take a look what it looks like when we lose neutral spine, and now we're putting more pressure on the neck, mid-back, and lower back. So again, we're going to maintain all 3 contact points. He's going to allow his knees to bend passively, and to stand, he is simply going to drive his feet through the floor. He's going to use his hips as the hinge, alleviating any forces off the low back. So now, a variation that we're going to show you is using the wall, okay? So, the wall is kind of nice. It essentially represents where we want your center of gravity to go. So as Dr. Steven goes into his hip hinge, he's going to allow his arms to come out ahead of him, and then again, he will use his feet to stand. Now notice, he made a little bit of an adjustment there. I barely want him to touch the wall. So as he begins to recognize and realize his range of motion, he will begin to slightly scoot forward, okay? Look at this. Look at all 3 points. He's maintaining a neutral spine, disassociating the spine from the movement. This is not a low back exercise. This is an exercise for his feet, for his hips, and for his upper back. All the wall does is just simply give him a target, and it essentially allows him to kind of organically and reactively do the right thing. This is our hip hinge with a wall hip hinge variation. Thank you very much.